Okay, some lecture notes on the anxiety disorders. These are among some of the most commonly diagnosed disorders in the United States. All of us have experienced anxiety symptoms at one point or another. When those symptoms are occurring in a normal context, in the context of a situation that should produce anxiety, that's considered normal. Like all the other disorders, these are symptoms that interfere with the individual's everyday life and are out of proportion for what's considered a normal response to a situation or event. So, again, we've all experienced fear. This is generally a biologically based response to a threat to our safety or someone else's safety. Um, Fear is necessary. It's a survival instinct. It keeps us away from things that we ought to be afraid of. Anxiety is a little bit more vague than fear. It's sort of that very uncomfortable feeling. And for individuals who suffer from things like generalized anxiety disorder, these feelings of anxiety can become overwhelming and feel very much like a fear panic response. And so we'll talk about some of the panic disorders and those panicked experiences in this lecture. So the first type of anxiety disorders that we'll discuss is this generalized anxiety disorder. It's again, like any other disorder, it needs to cause significant distress or impairment to the individual's life. It makes it difficult for them to go about their day-to-day life in a meaningful way. The symptoms should last about 6 months or more. They should be disproportionate. So, out of what's, again, would be considered a normal response to a situation, the person would feel like they don't have control over the level of anxiety that they're feeling, and also that they spend a lot of time worrying about their anxiety and worrying about many different things. They may frequently experience sleep problems. Many times with the anxiety disorders, we see what's called comorbidity with things like the depressive type disorders is not uncommon, and as well as substance abuse disorders and other things that can go hand in hand with these anxiety disorders. So, there are some theories about why an individual might develop this anxiety disorder. It can be seen more frequently in individuals whose day-to-day lives are stressful, and some of this stress can come from society, can come from economic situations, can come from racial identity, sexual orientation and identity, those kind of things. Anything where the individual is under a large amount of stress. Separation anxiety is a sort of form of anxiety that can be experienced in children. It used to be thought to be entirely isolated to children, but there is a new category in the DSM-5, which is looking at this as an anxiety disorder also in adults. And as with any new disorder, there is some controversy about this. So Carl Rogers, if you remember from Intro to Psych, his humanistic perspective was, Carl Rogers was a firm believer in this unconditional positive regard that we should have in childhood, and that builds our sense of self-worth. So the humanistic perspective would say that, it's a lot of anxiety about how am I being judged, how am I being looked at. There's not an enormous amount of support for Carl Rogers' explanation of anxiety disorders. If you remember also from, if you discussed Carl Rogers in Intro to Psych, his theories of this unconditional positive regard and genuineness and, being real with a client or an individual or a relationship those are all great foundations for any relationship, whether it's, romantic or friendship or therapeutic. So we're still using some of these principles, of not coming from a non-judgmental standpoint with individuals, but it's not the primary tool used to treat anxiety disorders. Really, what's considered to be one of the best therapies for generalized anxiety disorders and many of the anxiety disorders is this cognitive behavioral way of looking at it, that says it's really the way we think about situations and the behaviors that we do that sort of strengthen those anxieties. That's maladaptive, and we can use all of that to treat those disorders. So, re examining the things that the individual is anxious about and directing their behavior to, in many cases, encouraging them to approach the thing that they're afraid of, or think about what would happen if, the worst case scenario kind of thing, in a supportive environment. And again, that's really where Carl Rogers' perspective comes in a supportive, non-judgmental, reassuring environment to examine these beliefs that an individual has. Coco, what's the matter? What happened to your paw? Let me see. Come here. Give me your paw, Coco. Give me your paw. Give me your paw, baby cakes. Come here. Let me see. What happened? You got a little burn on your paw, Coco. Let me see. You gotta stop licking it. Scratch it. Let me see if this will. Ooh. Okay, so some newer theories look at sort of how we think about what we're thinking and trying to change. Is this a reality based idea, or can it be challenged? Um, Encouraging people to become more comfortable, again, in a supportive environment, usually through therapy, to be more tolerant of uncertainty, and to decrease these avoidance behaviors that are many times seen in individuals with anxiety. So, all of us try to avoid situations that make us anxious. I, like many people, am not a big fan of heights. I don't really go out of my way to go, to the top of a building and to look out over the city or whatever, wherever I might be. However, if I needed urgent medical care and the only place I could get it was on the top floor of the Empire State Building, I would go up there to get it. An individual with an anxiety disorder would avoid that situation at all cost. And what avoidance theory really says is that the more we avoid a situation, it decreases our anxiety, and that serves as a reward for that avoidance behavior. And whenever we're rewarded, we're more likely to do that behavior again. So taking away that anxiety rewards our behavior, and we tend to avoid those situations more and more. So it strengthens that avoidance behavior. Cognitive behavioral therapy looks to encourage doing that behavior that the person is afraid of or anxious about, and letting them, experience the anxiety and not move away from it, and sort of kind of work through that anxiety in that very stressful situation. And again, this is why a good, solid, supportive base for that therapeutic relationship is so important. So again, that's what cognitive behavioral therapy does, is looks at those maladaptive beliefs that the individual has and looks at each individual belief and works through all of those assumptions. Many times, cognitive behavioral therapy will use what's called mindfulness based therapy, which involves, some type of relaxation, meditation, to get that person to be in a more relaxed state and learn how to get themselves in that more relaxed state. There does seem to be some evidence that there is a biological basis for generalized anxiety disorder. This is supported by family research and twin studies and brain research. So there is definitely something going on in the brain that is leading to this excess in anxiety. Drug therapy is effective for treating anxiety. However, with a great warning, a great caveat, the medications that are very effective at reducing anxiety also have very high rates of dependence and addiction. So the barbiturates, the benzodiazepines are all good at reducing anxiety and are many times used in the short term. They're sometimes used in medical procedures before a procedure to reduce anxiety in the patient. In a controlled medical environment, those are very safe. However, anxiety disorders are typically long-term disorders, and long-term use of these potentially addictive drugs can be very dangerous for individuals. Antidepressant medications and antipsychotic medications are also being used with less dependence and addiction problems, and I'm not really sure why. Sorry, everyone, as I'm talking, I'm trying to figure out why there's a picture of a pilot here. You would not want your pilot having just ingested barbiturates or benzodiazepines. So, again, they have all sorts of side effects that are undesirable as well. So, medication sometimes is used in the short term for the treatment of these anxiety disorders or to get the anxiety under control. Sometimes individuals can't leave their homes, they can't drive, they can't ride in a car even. So many times individuals will use legal substances that are widely available, such as alcohol, to help control their anxiety, which in the long term, again, is not an effective and can be a very harmful way of trying to self-medicate. So usually a short-term use of these medications in conjunction with, and eventually only with, cognitive behavioral therapy tends to be the most effective and safest form of treatment for generalized anxiety disorder. Okay, now on to phobias. A phobia is an overwhelming, unrealistic sense of fear about an object, a situation, a feeling, a person, an animal, all sorts of things. There are many, many, probably thousands of phobias. Some are more common than others. But again, in order for this to be considered a disorder, a psychological disorder, it needs to interfere with the person's everyday life. So if you are, afraid of spiders, that's not really that unusual. However, if you can't sleep at night, if you can't get in your car to go to work because you're afraid you might see a spider, if you can't open up your backpack to get out your textbook or your laptop because there might be a spider in there and this is all you've thought about for the last hour and a half and you're late for class, or you can't go to work, things like that, when it's really interfering with the individual's day-to-day life, that's when it meets the criteria for a psychological disorder, or if it causes the individual a significant amount of distress. So there are specific phobias, which again are all of those things and places and people, spiders and snakes and heights and water and peanut butter. And again, if you just Google specific phobia list, you will see thousands of specific phobias that have been identified. Agoraphobia is a phobia, but it's one of the more common and it's generally considered separate from specific phobias. Agoraphobia literally translates into fear of the marketplace. It's a Greek word. Um, in general, individuals are typically afraid of leaving their homes or leaving their homes without a safe person, a partner, or someone who can be helpful to them if they were to experience distress while they're out of the comfort of their homes. So, specific phobias, they do seem to be more common in women than men. About 30% of individuals seek treatment. Treatment can be very effective for specific phobias. Really, for all of the anxiety disorders, there are very good therapies available. Some of them will take a lot of time, many of them take a lot of work, but treatment is available and treatment is relatively successful for these individuals. Many of these disorders require, like any other health condition, maintenance with treatment and maybe a reevaluation, but treatment can be very beneficial. So again, these phobias are persistent, meaning they happen very, very frequently. It's out of norm for what would be considered normal, so that it's disproportionate fear. They experience immediate, intense fear, and they will anticipate, what if I see that? What if I see a spider? What if it's going to be at the, outside, or what if there will be one in the bathroom? And they will avoid situations where they may encounter what they are fearful of, what their phobia is. So, just a review, agoraphobia, again, is generally when individuals are very fearful of leaving their safe home environments. They avoid going out as much as possible. Um, this is seen in about almost 3%, 2.5% of the population. Only 46% of individuals seek treatment. However, here's an interesting discussion question some of you may want to review. Agoraphobia in the age of COVID. How has COVID maybe affected individuals with all types of anxiety disorders, but particularly agoraphobia, when we were told for weeks and months at a time not to leave our house because it was dangerous to go out? How would that affect someone with agoraphobia or any of the phobias, really, or any of the anxiety disorders? On the flip side of that, the idea of telemedicine has become more and more popular. And would this be a reasonable and possibly more desirable form of therapy for someone with agoraphobia or some of the other anxiety disorders? So, if you'd like to explore that in the discussion section, I encourage you to do that. So, I talked about this a little bit with generalized anxiety disorder. The cognitive behavioral perspective believes that our thoughts about the things that we fear or that we have phobias about, our thoughts cause us to do certain behaviors or avoid certain behaviors. And when we avoid those behaviors, we're reinforced by that. Some of the treatments can include, again, some of these behavioral theories on modeling that we can learn from watching others, by observing others, and then slowly trying to imitate. Typically, a therapist, touching even a picture of a spider, let's say, to start with something kind of small. Watch the therapist touch the picture of the spider and then imitate that, and then get, build up gradually to being comfortable around spiders.